Hi everyone, welcome to Pediatrician Brothers. Today we're gonna talk about very common issue, what to do when expressive language delay is detected.
We'll walk you through how we diagnose it, how we manage it, and what can parents do to prevent it. When child has expressive language delay, we don't just count words, we evaluate social skills, we evaluate eye contact, play, general development, motor development, ear examination, oral examination, which might be interesting in terms of anatomical defect, neurological examination, hearing examination, and how the child is developing in general and how he understands the language.
Exactly, and typically we perform the following tests at minimum in every child. We should do complete blood count, blood lead levels, hearing test depending on examinations. We might also add some additional tests including genetic testing, and the differential diagnosis falls into four major categories. The first is isolated language delay, where everything else is normal. This includes a simple delayed milestones or specific language impairment, where language is the only one behind.
Yeah, these children usually have normal play, normal social engagement, and good understanding, but express themselves later than their peers. Second group is when language delay is part of a wider developmental condition.
That could be a global developmental delay, intellectual disability, or autistic spectrum disorder, where we also see poor eye contact, no pointing, or limited social communication.
And don't forget other conditions like selective mutism, speech sound disorders, apraxia, dysarthria, and even stutter.
Hearing loss is a big one. Even mild problems, especially with quiet sounds like F, S, the, can delay the speech.
Yeah, that's why every child with language delay needs an evaluation with an audiologist. Fourth cause, especially in our century, is low interaction, caregiver stress, or high screen time.
Kids learn language from people, not screens. The amount and quality of interaction matters. Management depends on the child's age and what type of delay we're dealing with.
Yeah, but remember that for children are the three early intervention programs provide essential speech therapy and developmental support.
Other children's school-based special education services can assess and support speech and language.
Yeah, speech therapy is effective. Studies show big improvements, especially when therapy lasts longer than 8 weeks.
Parents should remember that early treatment always gives the better outcome.
Yeah, we refer to specialists like developmental pediatrician or neurologists when we suspect autistic spectrum disorders, apraxia, or other conditions.
The primary care doctor also plays a big role to track the progress, coordinating services, and watching for long-term academic and behavioral difficulties.
Yeah, and now let's talk about the prevention. The key is something called language nutrition, and we're going to explain what it is.
This means that we should give your child a rich language environment every day.
Yeah, read to your child, for example. This increases vocabulary and exposes them to new words.
Use dialogic reading, ask questions, point at pictures, and encourage them to talk about the story.
Yeah, narrate your daily activities. Let them what you are doing as you do them through the day.
Respond and expand. If your child says car, you say, yes, a big red car.
Yeah, limit screen time. Even educational videos can reduce real conversation.
And you can also use gestures along the words. This makes language easier to understand.
So remember, early evaluation and a rich language environment can make a huge difference.
So if you're worried about your child's speech, don't wait, get them evaluated early.
Yeah, thanks for watching Pediatrician Brothers. Subscribe for more evidence-based pediatric guidance, and also remember that how to detect and what are the red flags for the expressive language delay are discussed in the previous video.
See you later.